Assalamu alaikum and welcome into 16th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into 16th match that is between Abbasi Shaheed challengers and Sheikh Zayed roarers. It is in fact first match of Group F, and we all know that according to the format of the match, only one top team from each group will move to Super 6 stage, and it's again a knockout match. Today, we are blessed with the kind presence of Professor 𝐏𝐚𝐤𝐬𝐬 Sahab. He is Professor of Medicine and he would be serving as an umpire of today's match. He is Senior Vice President of PSIM. And for moderation purposes, we have with us Assistant Professor of Cardiac Electrophysiology, Dr. Qurban Hussain Khan Sahab. He is Assistant Professor of Cardiac Electrophysiology at RIC Rawalpindi. For further moderation, over to Dr. Qurban Hussain Khan Sahab.
Thank you, Usman Sahab. Welcome one, welcome all to this match 16 Group F. We are in another knockout stage and we've got two teams, one from Lahore, one from Karachi, the big cities of Pakistan. We've got the Abbasi Shaheed Hospital challengers from Karachi battling against Sheikh Zayed Lahore roarers from Lahore. Once again, I would like to remind everyone that this session is powered by Wilson's Pharmaceuticals in association with the Pakistan Society of Internal Medicine and the Pakistan Hypertension League. Today's umpire will be our legendary Professor Azizur Rahman. Now, one thing that you need to note is winning is not enough. You need to win very, very well. As is the example of the previous groups, you need to score as highly as possible, because you're not only competing against your opponents, you're competing against the entire group, in this case Group F. So without further ado, I'd like to get to introduction of the teams. I will start with Karachi. Can we introduce the Abbasi Shaheed Hospital challengers, please? Abbasi Shaheed, are you there?
My name is Dr. Sumaila Kareem. With me on the left side, Dr. Maha, and there is Dr. 𝐏𝐚𝐤𝐬𝐬 and Dr. 𝐏𝐿𝐬𝐬.
Okay, I would just like to remind you that you need to talk into the microphone, and whenever you do your deliberation, your microphone has to be switched off. We need to hear what you're saying. Welcome to the quiz. We wish you all the best. The format of the quiz will be that there will be an electronic coin toss. Abbasi Shaheed, you will choose, but I need to introduce the other team first. So you will decide the coin toss, and then we will proceed from there. Okay, Lahore, Sheikh Zayed, are you there?
Hello, Assalamu alaikum.
Wa alaikum salam. I can hear you just fine.
I'm Dr. Ali Shahbaz. With me, Dr. Farooq Amjad, Dr. Abdur Rahman, and Dr. Umar Hassan from Sheikh Zayed Hospital, Internal Medicine Department.
Wonderful, wonderful. Well, fate is not in your hands, because Abbasi Shaheed will call the coin toss, and then we will decide which team goes first, and we will also decide which case is first. So, electronic coin toss, heads or tails, Abbasi Shaheed?
Heads.
Okay, they've called heads. Let's roll that coin. Are they going to be the winners? Roll the coin. Yes, they've done it. They've done it. A team full of ladies, and they've picked the right coin. So, what do you want to do? Do you want to ask questions first, or do you want to answer questions first?
We would throw the case.
Okay, so you want to ask questions first, and you'll see what Sheikh Zayed can put up as a total. Okay, that's the first part of your duties as coin toss winners. The second part of your duty is to decide which case will be done first. Okay, not you.
B.
You want case B to be the first case?
Yes, we would put case A for ourselves, and we would throw case B.
Okay, so case B is the case that's going to be answered by Lahore, and Karachi is going to answer case A, and naturally case B will be the first case. Okay, thank you, Abbasi Shaheed Hospital. That's your role done for now, and you will be asking the questions. So be on standby. I just want to remind you that when Sheikh Zayed are answering their questions and when they are deliberating, please do not talk into the microphone. Thank you very much. Let's go to Sheikh Zayed. Hello, Sheikh
Can you
Zayed.
kindly repeat it? Can you
Sure.
kindly repeat it? We
Sure.
had some issue with the internet.
No problem. So the coin toss was won by your opponents from Karachi. They decided to field. You are going to bat, so you are going to answer the questions first. They will be asking you the questions. The first case is going to be case B. So that's your case. You have a maximum of 10 questions. You'll get more if there's a sudden death situation. You get 6 points for a correct answer and 0 for an incorrect answer. The idea is to score as highly as possible because you are in competition not only with your opponents from Abbasi Shaheed Hospital, but you're in competition with the entire group. So you need to score as high as possible. Aim for a 10 out of 10 if possible. So do you understand the instructions?
Yes, we are ready to go.
Okay, back to Abbasi Shaheed Hospital. Let's bring out case B, please, and read it out.
A 62-year-old male presents with uncontrolled hypertension despite adherence to a triple drug regimen, amlodipine 10 mg per day, lisinopril 40 mg per day, and hydrochlorothiazide 25 mg per day. His BP remains elevated to 180 by 90 millimeter of mercury. He has a history of type 2 diabetes, hyperlipidemia, and a previous transient ischemic attack. His lifestyle is sedentary and he consumes a high sodium diet.
Sheikh Zayed, did you get that history? Did you hear
Yes,
that?
we are reading it right now. We are reading it right now.
Okay, did you hear the commentary by Abbasi Shaheed?
Yeah, we heard it.
Okay, fine. So take your time, read it as well. Abbasi Shaheed, next is reading out the questions. So you read out the questions carefully from 1 through to 10 and make sure you read out the options clearly as well. Back to Abbasi Shaheed, please. Let's move on to question 1. Read it out.
Question 1. What is the most accurate definition of resistant hypertension according to current guidelines? Options.
Read out the options.
I cannot see the options.
Okay, I'll read it out. Okay. Option A, blood pressure above goal despite using 3 antihypertensive agents from 3 different classes at optimal doses, including a diuretic. Option B, blood pressure greater than 140 by 90 millimeters of mercury despite using any 3 antihypertensive agents. Option C, blood pressure above 160 by 90 millimeters of mercury despite using 3 antihypertensive agents. Option D, blood pressure above goal despite 4 or more antihypertensive agents. Option E, blood pressure above 180 by 100 millimeters of mercury regardless of treatment. Your clock starts now, Lahore. Have Lahore on the screen, please. Lahore, deliberate in the microphone so we can hear what you're saying. We need to hear what you're saying. "30 seconds gone."
We want to go with option A.
Option A, are you sure? Is that the opinion of all of you?
Yeah, we are sure.
Okay, let's lock in option A. Are they right? Do they get off to a flyer? Yes, they have. They've gotten off to a flyer. So they've picked up a full pitch delivery from the fast bowler on the first delivery of the innings, and they have smashed it above his head into the side screen for a sixer. Great, great performance. Well done. Let's move on to question 2. Read it out, Abbasi Shaheed.
What is the next best step in managing this patient's resistant hypertension? Option A, add a beta blocker. Option B, add a spironolactone. Option C, increase diuretic dose. Option D, switch to a different antihypertensive class. And option E, refer for renal denervation therapy.
Okay, so options there, A to E. The clock has started. 55 seconds left. Let's have Lahore on the screen, please. So they've got various options. Deliberate, take your time, think about it. Half your time is gone. You've still got time though. You've still got time.
We want to go with option B.
Option B. Are you sure?
Yeah, we sure.
Okay, let's go with option B. Yes. Yes, yes, yes. Option B is the correct answer. So they've picked up a delivery which is going down the leg side, and they've slogged it over the leg side boundary, and it's gone for another 6. Well done. Well done. Let's move on to question 3.
If BP remains uncontrolled more than 170/95 after adding spironolactone, what is the most appropriate next step? A. Add clonidine, add hydrazine. C. Increase diuretic dose. D. Switch to a different renin inhibitor. Option E. Consider renal denervation therapy.
Option D is switch to a direct renin inhibitor. The other options are as said previously. Lahore on screen, please. 45 seconds left. So two scored questions, 2 6s so far. They can really.
We want to go with option B.
Is that B for brother?
We want to go with option B.
B for brother.
Yeah, B for brother.
All right, let's lock that in. They seem sure about it. They seem confident. Option B, hydralazine. Are they right? Yes, they're right. They're right. This time the bowler bowls it short. They hook it. They hook it over fine leg, and it's gone for another 6. So they've gone for it, and they've scored 6 out of 6. 3 6s in a row. Score is 18 from 3. Let's move on to the next question. Read it out.
What is the most common cause of pseudo-resistant hypertension? Option A, medication non-adherence. Option B, medication undertreatment. Option C, white coat effect. Option D, inaccuracy BP measured. And option E, high sodium intake.
Start the clock. 1 minute to answer this question. Lahore on screen. So think about your options. Take your time. Remember your training. Half the time has elapsed. You've still got time.
We want to go with option A, medication non-adherence.
Is that the opinion of all of you?
Can you please hold it here? Can you please hold it here?
Sure.
There is some typing mistake. The correct answer is A. I think contrary to what is shown in the question paper, the correct answer is A.
We said option A.
Yeah. You said right.
You said right.
You're absolutely correct.
Our wonderful umpire, thank you very much, sir, for your intervention. So they've gone for A, and Professor Azizur Rahman has confirmed A. So that's it. That's once again wonderful. A full score there, 6 out of 6 again. So can we add that to their scoreboard, please? Their score is now 24. They are correct. So we just need to get the technical team on board. That's it. It's official. 4 out of 4, score of 24 from 4 questions. Excellent performance, wonderful by Sheikh Zayed Lahore. Roarers, well done. And thank you, sir. Thank you for your intervention. Thank you very much. So let's let's go for the next question. So the heat is really being turned up. I mean, they're really building up a competitive score now. Let's read out question 5. ASH, challenges.
If BP remains uncontrolled more than 160/90, despite optimal four-drug therapy and lifestyle changes, which non-pharmacological intervention is recommended next? Option A, renal denervation therapy. Option B, carotid baroreceptor stimulation. Option C, low-sodium DASH diet. Option D, surgical sympathectomy. And option E, CPAP therapy for suspected sleep apnea.
So non-pharmacological interventions, you've got 5 options. Lahore on screen, please.
We want to go with option A, renal denervation therapy.
Okay, that's very decisive, very rapid, within 10 seconds. Are you sure? Is that the opinion of all of you?
Yeah, we are sure with that.
Okay, let's lay it on the line. They've gone for it. Stop the clock. Option A, are they right? Yes, yes, they're right. So this time the opposition has bowled a spinner. The spinner has tried to bowl a googly, but they have charged up the pitch and Slog smashed it once again on the offside, and it is gone for another 6, and this time it's out of the stadium. Well done. Brilliant. 𝐏𝐚𝐤𝐬𝐬 6, another 6, 5 sixes in a row, 30. They're on track for a very, very competitive score. Question 6, please.
What is the typical reduction in systolic BP expected after renal denervation therapy? Option A, 5 to 10 millimeter mercury. Option B, 10 to 15 millimeter mercury. 15 to 20 millimeter mercury. 20 to 25, or 25 to 30 millimeter mercury.
Okay, so 5 to 10 is A, 10 to 15 is B, 15 to 20 is C, 20 to 25 is D, and E is 25 to 30 millimeter of mercury reduction in systolic BP after renal denervation. 45 seconds left. What are they going to go for?
We want to go with option C.
Option C. Okay, is that because you know, or are you guessing?
We are hopeful.
Okay,
Not
they're
sure.
hopeful. They're hopeful. Let's go for it. Nothing wrong with hope. Let's go with hope. Option C. Oh no, hope fails. They were hopeful. They charged the fast bowler, but unfortunately he bowled an in-swinging Yorker at over 100 miles an hour, and it has shattered their off stump. Shattered. So that's unfortunate. 6. They were going for 6 sixes in a row, but they were out this time round, but they can still get a very competitive score. So we're still in the hunt, we're still in this game, and we're still in this tournament, 𝐏𝐚𝐤𝐬𝐬. So keep going, don't lose hope. Let's go on to question 7.
Which of the following is a known complication of renal denervation therapy? Hypertension, renal artery stenosis, nephropathy, AFib, or refractory hypertension?
So renal denervation, again. Five complications. Which one is it? Half your time has elapsed. Take your time, think about it.
We want to go with option C, nephropathy.
Okay, option C, nephropathy. Let's lock it in. They've had time to confer. Let's see if they're right. Option C. Oh no. Once again, they tried charging the fast bowler and he's bowled it short. It's right at their neck. It's snicked the bat and it's gone behind to the slips, and they are caught out. Caught out. Renal artery stenosis is the correct answer. Unfortunately, that's 2 in a row where you've been caught out. Let's see if we can still get a good score. 8 out of 10 is still a very competitive score. Can we go up to question 8, please?
What is the recommended adjustment in antihypertensive medications following renal denervation therapy? Continue all medications unchanged, reduce all doses by 50%, discontinue diuretics, add beta blockers, and switch to other classes.
60 seconds. Half your time has elapsed. Think logically. Think logically.
We want to go with option E.
Option E. E for elephant, is that right?
Yes, E for elephant.
E for elephant. Stop the clock. E for elephant. Are they right? No, they've had their trunk pulled. That is very, very unfortunate. The answer was A, and this time they've tried to sweep the spinner, but it's gone high into the air, into the night air, and they have been caught by the wicketkeeper. So that is a hat-trick of wickets. So can they repair themselves? Can they bring themselves up to something resembling a competitive score? We shall have to see in the next question. 2 questions left. Let's go for it. Don't lose hope, Sheikh Zaid. Question 9, please.
Which of the following is considered a secondary cause of resistant hypertension that must be ruled out? Coronary artery disease, obstructive sleep apnea, hypercholesterolemia, iron deficiency anemia, primary polycythemia.
We want to go with option B. B for brother.
B for brother. Is that right? B for brother, obstructive sleep apnea, a cause of resistant hypertension that must be ruled out. Are you sure?
Yeah, we are sure.
Okay, they're sure. Can they rebuild this innings? Can they rebuild this innings? Stop the clock. Option B. Yes, yes, yes. They've received a short and wide delivery, and they have square cut in the air, and it's beaten third man, and it's gone over the boundary for a sixer. They're back in this match. Score is 36. They need one more to make it competitive. Let's see, can they do it? Options are coming up for question number 10. Read it out, ASH challengers.
What is the primary mechanism by which renal innervation reduces blood pressure? Activation of sympathetic nerves, inhibition of parasympathetic activity, disruption of renal sympathetic nerves, stimulation of baroreceptors, or decreased renal sodium resorption?
Lahore on screen. Can they do it?
डी भी नहीं हो सकता हाँ सी होना चाहिए डी भी नहीं होना चाहिए ठीक है
So they're using a process of elimination.
yeah
We are going with option C. Disruption of renal sympathetic nerves.
Okay, so I think they've thought it through. We've heard all the deliberation. Let's lock in option C. Are they right? Are they right? Yes, they're right. The opposition tried to trick them by bowling a slower ball, but they smashed it. They smashed it very hard and out of the stadium for another 6. So they finished with a flourish. They scored 2 sixes on the last 2 deliveries. They've got a score of 42, 7 out of 10. It is a competitive score with the pressure of chasing, with the pressure of some difficult questions. Maybe they can do it. Maybe they can do it. We'll have to see how ASH challengers do. So 1 innings is over. I think the level of questions was pretty challenging for Sheikh Zaid Lahore Roarers. Can we have our umpire, Professor Azizur Rahman, on just for his feedback if he's available? Sir.
I would like to ask the answering team, were the questions fair and relevant to their speciality?
Lahore, can we have Lahore?
Sir, I think apart from renal denervation therapy, I think other questions were fair and relevant to the course.
Well, I think although renal denervation is not a very common practice, but for a resistant hypertension, when you have used 3 or 4 drugs, including hydralazine, you have to go for device therapy. So it is actually relevant, maybe at a postgraduate level. So you did reasonably well. This question was slightly difficult, but you did, I think, reasonably well. And I think you're very much in the match still, because we have to see how the other team performs. And just incidentally, I observed that it's men versus women also. The match is not only two teams, but just incidentally, men versus women. Let's see who
Yes,
performs.
sir.
So
Thank you, sir.
the battle of the sexes carries on. So I think you should be proud of yourselves. I think as Professor 𝐨𝐬𝐿 mentions in the past, has mentioned in the past, and again, renal denervation is an important part going forward in clinical medicine, and it's all about learning. And now you've learnt, and I think that's the positive side of competing in this competition. So well done, Sheikh Zayed. I think you did very, very well. Let's see how AS8 challengers do. Can we open up case A? Read it out, please, Sheikh Zayed.
A 53-year-old postmenopausal woman presents with 1 week history of chest heaviness. She also reports intermittent fatigue, generalized weakness, and increased urination. She has no prior history of diabetes or hypertension. Her lifestyle is sedentary. On examination, she is obese, height 165 centimeter, weight 82 kgs, BMI of 32 kg per meter square, pulse is 98 beats per minute, regular and of normal volume. Blood pressure is 160 by 110 in both upper limbs. Acanthosis nigricans is noted on the posterior neck. Capillary random blood glucose is 210 milligram per deciliter. Lifestyle and dietary modifications were initiated along with pharmacotherapy, including lipid-lowering agents.
Okay, AS8 challengers, is the scenario on screen for you?
But we have to read, we can't see. So we have to read first.
Take your
Can you please
time.
wait?
Take your time. It's a long scenario. So this is a 53-year-old woman with chest heaviness, intermittent fatigue, weakness, increased urination, obese, pulse is regular, blood pressure is high in both upper limbs, acanthosis nigricans, a high random blood glucose, lifestyle and dietary modifications initiated, along with pharmacotherapy, including lipid-lowering agents. So that's the case. Can you read that? ASH challenges, I can't hear you. You need to have the microphone on.
Yes, yes.
Okay, I
Yep.
need you to keep the microphone on while you're deliberating. It should not be silent at all. We need to hear exactly what you're discussing, exactly what your chain of reasoning is. It helps with medical education in general and also in adjudication. If Professor 𝐨𝐬𝐿 needs to make a decision about what was actually said, we need to know very, very clearly. So your microphone will be on from now on, please. Okay, let's read out the first question. So Lahore, Sheikh Zayed, can you read out question 1 with the options, please?
Question number 1. Which of the following statements about metabolic syndrome is incorrect according to ATP3 criteria? Option A, insulin resistance and central adiposity are required for the diagnosis. Option B, a diagnosis requiring any 3 out of 5 established criteria. Option C, metabolic syndrome affects 20 to 35% of adult population worldwide. Option D, cardiovascular risk increases with severity of metabolic syndrome. Option E, residual risk refers to the atherosclerotic risk after
We cannot
addressing
see the
non-success.
question. We cannot see the question. We cannot see the question, and voice is also not clear.
Okay. Can we, technical team, can you ensure that ASH challengers can see the question? So we're sending them the screenshot of the question. So can you see it now, ASH?
No, not yet.
So our representative is there. We are sending them a screenshot of question 1 along with the options. When they receive, they can confirm it. Obviously, we can't start the clock until they actually see the question. They've heard it, but seeing it is different. Seeing is believing, as they say. ASH, have you received the question? Okay, your clock has started. You have received the question. So is it A, B, C, D, or E? Remember, you're choosing the one statement which is incorrect. Not correct, incorrect. 40 seconds left. We're joined by the wonderful Professor 𝐏𝐴𝐤𝐬𝐿 Sahib, and we will be going to him after this question. Half the time is elapsed.
Yes. Ratio नहीं 35% को affect करता है या उससे कम?
10 seconds, guys.
C.
We need an answer.
C.
Option C is the incorrect one. Okay, we've got no time to confer, no time to argue. Option C, are they right? Are they right? No. They were looking for the one incorrect statement, and the incorrect statement was option A. Insulin resistance and central adiposity are required for diagnosis. That was an incorrect statement, and unfortunately, ASH challengers came out to face the first delivery. They played outside the line of off stump and edged it to first slip. So a very, very tough start. I think they're facing Glenn McGrath or someone like that in the first delivery. So it's very, very tough. Very, very tough start for ASH. But
if you allow me to make some clarification, actually, the question is the criteria in ATP3. Although insulin resistance and central adiposity is the mechanism behind metabolic syndrome, but that is not included in the criteria. It is not essential.
Thank you for clarifying that, sir.
Thank you.
So we are joined by Professor 𝐏𝐴𝐤𝐬𝐿 Sahib, if I'm not mistaken.
Yeah, he was there. I saw his face. He disappeared, I think.
Okay, I don't think he's with us right now. When he comes back, inshallah, we will bring Professor Sahib back. Thank you very much, sir, for your kind clarification on the mechanism and definition. So let's move on to question 2. Hopefully, we can get question 2 to ASH challengers soon enough. Question 2, can you read it out, please, Lahore?
Which of the following statements about statin therapy in diabetic patients is incorrect? Option A, high-intensity statins are recommended for diabetes with atherosclerotic cardiovascular disease. Option B, moderate to high-intensity statins are advised for diabetics aged 40 to 75. Option C, most evidence for statin use in diabetes come from subgroup analysis. Option D, statin provides greater relative risk reduction in diabetics than non-diabetics. And option E, statin use in pre-diabetes is linked to increased incidence of new onset diabetes.
So, ASH, are you there? Can you see the questions? It's on your phone. Good.
Yes, I see.
So you've got 50 seconds.
Diabetes comes from incorrect. ऐसा तो नहीं है कि diabetes ज़्यादा वो होता है infection और I'm not sure.
Professor 𝐏𝐴𝐤𝐬𝐿 Sahib is here. We will go to him as soon as they've answered this question. Welcome, sir.
Assalamualaikum.
Walaikum salam, sir.
Sorry, I had some connection problem, you see. So I lost the link.
It's great to have you on board, sir. Very tough competition between Sheikh Zayed Hospital, Lahore and Abbasi Shaheed Hospital in Karachi. They've got 10 seconds left to answer this question on diabetes. 5 seconds, guys. Give me an answer.
Option D. Option D.
Okay, stop the clock. So the one incorrect answer, the one incorrect statement they say is that statins provide greater relative risk reduction in diabetics than non-diabetics. Lock it in. Let's see if they're right. Yes, yes, they are on the money. They are on the money and they have played a blinder. They have faced an in-swinging Yorker and they have played it to perfection, timed it. on the leg side, and it has gone over the boundary for a 6. So that's a brilliant, brilliant start for them. So Professor Ishaq Sahab, can we have Professor Ishaq Sahab back?
Yes, I'm here.
So it was a very tough first case. We were asking them questions about renal denervation therapy, which even though it's available in Pakistan in certain centers, it's not very common. And they scored a score of 7 out of 10. And now Abbasi Shaheed Hospital are answering similar questions on diabetes and hypertension in this case.
Very interesting.
Thank you very much, sir. Great to have you on board. Okay, let's move on to question 3, please. And have
Which of
Lahore
the
on
following?
screen. Carry on.
Which of the following is considered the primary pathophysiological driver in the development of metabolic syndrome? A. Genetic predisposition. B. Insulin resistance. C. Systemic inflammation. D. Fat accumulation in adipose and non-adipose tissues. And E. Hypertension.
60 seconds, guys. ASH. 5 potential mechanisms, pathophysiological drivers in the development of metabolic syndrome. Is it genetics? Is it insulin resistance? Is it inflammation? Is it fat accumulation, or is it hypertension? Which one of these 5? Take your time, confer. Our experts always say take your time. Keep your microphone on. Microphone on, please. 20 seconds left.
B.
Ball.
B for ball.
B for ball. Okay, you need to keep your microphone on at all times, even when you're conferring, please. But you've given an answer. 6 seconds are left. Insulin resistance. Lock it in, please. Lock it in. Oh, that's very unfortunate. You faced the spinner. You thought it was going to turn in, but he bowled a dusra. You edged it, and it's gone to the wicketkeeper, and it's caught in his gloves, and you are out. So, tough beginning. You've just got 1 out of 3 correct, and this time you were bamboozled by the mechanism question. No problem. You can still win this competition. You need to score all of your questions correct, and then you can outdo Sheikh Zayed. Let's go to the next question.
Question number 4. In individuals with obesity and metabolic syndrome, what is the approximate annual risk of developing type 2 diabetes? Option A 2.5%, option B 5%, option C 7.5%, option D 10%, option E 12.5%.
60 seconds. Approximate annual risk of developing diabetes in obesity and metabolic syndrome. 5 options. Thirty seconds left. Microphone on, please.
Obesity and metabolic syndrome.
7.5.
We need your microphone on at all times. 3 seconds, quickly.
Option C.
Okay, let's give them that. On the buzzer, shot on the buzzer. Is it a swish? Option C. No. Once again, they tried playing against the spin, and they have edged the ball in the air, and it's caught by one of the outfielders. So they are out again. So that's 1 out of 4 answered correctly. So we weren't able to get this one right.
It is actually the annual risk. Although the patient described in this scenario, most of these patients will ultimately develop diabetes, I think almost 50%. But the question is about annual risk. So that is why it's just 5%.
Thank you, sir, for the clarification. So annual risk of developing type 2 diabetes in these metabolic syndrome patients with obesity is 5%. So that's an interesting learning point for everyone. Next question, please.
Which of the following statements regarding body mass index is incorrect? Option A, obesity classification class 1, 30 to 34.9, class 2, 35 to 39.9, class 3 greater than 40. Option B, BMI cutoff values can vary across populations. Option C, BMI may overestimate adiposity in muscular individuals. Option D, BMI is a strong independent predictor of cardiovascular disease. Option E, higher BMI may be protective in patients with heart failure.
Start the clock. So which of the statements is incorrect? Incorrect statement is what you're looking for. Microphone on, please. Thirty seconds left. Microphone on, please. You've got 12 seconds.
E. E for elephant.
E for elephant. Okay, that's fine. Stop the clock. E for elephant. No, that was a correct statement. The incorrect statement was that BMI is a strong independent predictor of cardiovascular disease. That was incorrect. So, once again,
This is again slightly tricky question. Actually, it is the correct statement. Obese people, they do better with heart failure, and the exact mechanism is not well understood. It is called obesity paradox.
thank you, sir. Very informative as
And
always.
C is D is the wrong, because in the statement C you see sometimes BMI can overestimate adiposity in athletes. So BMI alone is not actually a predictor. You have to have additional factor, like you have to have extra visceral fat for cardiovascular disease.
Thank you very much, sir. Thank you very much for that clarification. So let's move on to the next question. So ASH are having a tough time of it, but
Which of the following statements about weight loss and cardiovascular risk is incorrect?
read out the options, please.
Weight loss, option A, weight loss is the most effective strategy to prevent progression of cardiometabolic disease. Option B, the protective effect of weight loss on type 2 diabetes risk persists even if pressure. Option D, it lowers triglycerides and LDL cholesterol while raising HDL-C. Option E, it improves LDL
stop the
particle
clock.
size by
I'll read
reducing
out the
small
options.
dense LDL.
The options are A, weight loss is the most effective strategy to prevent progression of cardiometabolic disease. B, the protective effect of weight loss on type 2 diabetes risk persists even if weight is regained. C, weight loss reduces blood pressure. D, it lowers triglycerides and LDL-C while raising HDL-C. And E, it improves LDL particle size by reducing small dense LDL. Which one is incorrect? You've got 32 seconds left. Ten seconds left. You've got to go for broke. 5 seconds left. ASH, mic on, please.
D.
D for desperate? I don't know. D is the option. Load it up. No, D was a correct statement. Weight loss does lower triglycerides and LDL while raising HDL-C. The incorrect statement was B. The protective effect of weight loss on type 2 diabetes risk persists even if weight is regained. Naturally, if you regain the weight, you regain the risk. So that's very unfortunate. That's 6 questions down and 1 correct answer so far. But that's fine. You're in this game, you're competing, and you know, it's not easy coming up there and competing in front of everybody. So the idea is to learn, and we're all learning on this show together. Keep fighting, get as many as you can right, and I'm sure you can be proud of yourselves despite everything. So carry on. Keep it up. Question 7, please.
A 65-year-old man with type 2 diabetes is asymptomatic but referred for cardiovascular screening. Which of the following statements is not true according to CAD screening in diabetic patients? Option A, exercise stress testing is more informative when combined with imaging. Option B, diabetics often have a blunted heart rate, 2, BP response and silent ischemia. Option C, AHA recommends intensified preventive measures if subclinical cardiovascular disease, CAD, coronary artery disease is detected. Option D, the DIAD study showed low event rates and no benefit from routine screening. Option E, routine CAC scoring and CTCA is recommended at the time of diagnosis.
So which is incorrect? Sorry, which is incorrect regarding CAD screening? You've got 31 seconds remaining. Keep your microphone on so we can hear you. Ten seconds.
Option D.
Okay, so stop the clock. Option D. Oh no. So the incorrect answer was that routine calcium scoring and CT coronary angiogram is recommended at the time of diagnosis. That is the incorrect answer. So unfortunately, another incorrect answer from ASH Challengers. Just keep going. Let's see if we can get some more right. Next question, please.
Which of the following statements about lipid lowering option in statin intolerant patients is incorrect? Lifestyle modification can lower LDL-C by up to 15%. Bile acids, sequestrants, and ezetimibe each reduce LDL-C by 25 to 35%. Ezetimibe plus moderate dose statin can approach effects of high-intensity statin. Fibrates and niacin are considered in mixed dyslipidemia or high triglycerides. PCSK9 inhibitors are used in severe hypercholesterolemia when statins are not tolerated.
So which is the incorrect answer? Twenty seconds. Come on, guys, 10 seconds. Go for broke. Microphone on.
D.
What was that?
B.
All right, you said B before and you said B again. So are they right? Are they right? Can they pull this one out of the bag? Yes, yes, they are right. They are absolutely right. So well done, excellent. Despite suffering a lot of unfortunate dismissals, this time you have run with confidence down the pitch and smashed the fast bowler back over his head and into the side screen for a 6. Well done. Very, very brave. Excellent. Next question, please.
Which of the following is not included in ATP3 diagnostic criteria for metabolic syndrome? A. Increased waist circumference. B. Elevated fasting glucose. C. Reduced HDL. D. Elevated LDL. And E. Elevated triglyceride.
Start the clock. 1 out of 5 is not in the ATP3 diagnostic criteria for metabolic syndrome. Straightforward question. Thirty seconds. Twenty seconds. Clock is ticking. Keep your microphone on so we can hear your deliberations. Three seconds, guys. Come on. I need an answer. What was that? You said something.
C for cat.
C for cat. Okay, well, there's no time to confer. C for cat. Lock it in. No. Common misconception. LDL is not in that definition. HDL is, triglycerides are, increased waist circumference, elevated fasting glucose, all these things are there. But elevated LDL is not in that definition. So that's unfortunate. Once again, skittled out by the medium pacer. He has clipped your off-stump bail and the bail has come off and they're celebrating their victory. So you've got one question left. Let's go out with a flourish. Let's go out with a bang. A spectacular final act of defiance by Abbasi Shaheed Hospital Challengers. Let's see what you can do. Read out question 10, please.
Which of the following is not a feature of erosion-prone vulnerable plaques? Option A, large lipid-rich necrotic core. Option B, thin, inflamed, fibrous cap over a necrotic core. Option C, expensive positive remodeling without a significant lumen narrowing. Option D, neovascularization, plaque hemorrhage, adventitial inflammation. E, none of the above.
So, which is not a feature of an erosion-prone vulnerable plaque? Thirty seconds. Twenty seconds. Ten seconds. 5 seconds. Answer now. I can't hear you. You're trying to say something. Your mic is off. We can't hear them. They are trying to answer. They have an answer, but we can't hear them. I think there's been a power cut. Unmute, please. Okay,
They are
let's
saying option 1, I guess.
So is that option A? Option A. Nod your head if it's option A. Okay, so you've gone for option A. Let's wait for them to say something first. We need to be 100% sure before we click on it. I think they're saying option A, but until I hear it with my own ears. Option A. Let's click that. Are they right? No, they are not. No, they are not. That's very unfortunate. A large lipid-rich necrotic core is definitely a feature of erosion-prone vulnerable plaques. These are all A, B, C, and D are all features of vulnerable plaques. The correct answer was none of the above. So that's unfortunate. They battled hard. They did their best, but the questions were quite tough, I think. The questions for both teams were quite tough, but 𝐏𝐸𝐬𝐬 seemed to do better given the pressure. They seemed to handle the pressure a little bit better. So it's one of those low-scoring games. 𝐏𝐸𝐬𝐬 had a decent total of 42. Unfortunately, Abbasi Shaheed Hospital could only manage a score of 12. But that's the name of the game. There have to be people who score more and others who score less. So congratulations to 𝐏𝐸𝐬𝐬 Hospital Lahore Roarers. Very, very good performance in difficult circumstances. I believe some of the questions were quite challenging, particularly for renal denervation, which is not a common procedure in Pakistan right now, probably will be in the future. So you did very well. Can I have your feedback? How do you think it went, and how do you think you performed?
It went great. I think it was the renal denervation therapy was a difficult question. Apart from that, I think we did good.
Okay, well done. I want to congratulate you on a very fine performance. You did very well. As to whether you're going to get through to the next round, I don't know. It depends on the other matches. But for now, congratulations on winning this interesting contest. Can we have Karachi?
Thank you so much.
You're welcome. Karachi, Abbasi Shaheed Hospital. Can you guys hear me? Is the mic permanently off? Well, I'm sorry. I would have loved to have heard from Abbasi Shaheed Hospital or their team and given their experience. But I would like to say one thing, that it's not about winning or losing. It's about gaining knowledge, understanding disease processes and understanding treatments more and more clearly. And I think today has demonstrated that we're all learning. There are things that you may not have picked up. There are things that Lahore may not have picked up. But it's a stimulus. It's a way of letting us know that we need to get back to the books or get back to the internet and study and improve our knowledge. And that's the name of the game. It's to improve the knowledge of postgraduate residents. And I think we're doing that with this competition. Before we go, I'd like to get feedback from our umpire, Professor Azizur Rahman, on today's contest.
I think your observation is right. The questions were a little tough. But in any examination, it is very hard to make sure that both questions are of equal difficulty, because they belong to different scenarios, and it depends if the candidates are exposed to that scenario or not. They were slightly difficult, but since it was a competitive, both teams were comparing, so the 𝐏𝐸𝐬𝐬𝐬 performed better, and they are rightful winner. But as you say, we are all learning actually. I'm also learning here. So everybody is a winner in that sense, that everybody is learning. So that's the spirit of the game.
Thank you very much. Thank you very much for your esteemed observation, sir. So that's a wrap. I mean, today's contest, it was one of those low-scoring competitions. Professor Ishaq Sahab, are you there, sir?
Yes, I am very much there, and I've been listening to the answers. Well, it was a bit disappointing, and they need to really work hard to come up to the standards, because the matches that we had earlier on have shown quite a good score on both sides. So this is the lowest score that I've seen so far, maybe one of the lowest scores. So I think it should provide them with a stimulus, with a reason to study and explore knowledge and learn and present better. Question equality दोनों की एक जैसी होनी, it is always difficult. One question has to be slightly different from the other one. And the other thing is that the components of the system, sometimes the questions are quite challenging. The negative, to pick up the negative question is also slightly difficult than the other modes of asking the answers. But on the whole, it's a match, it's a competition which leads us to learn and learn more. And as my dear friend Professor Ziraman said, we are also learning. And I think so much is being added into the therapeutics and diagnostics of medicine that these youngsters have to keep themselves up to date. With this, Qurban, thank you very much for your wonderful moderation. And my congratulations to Sheikh Zayed Hospital for their good performance. And my
Thank
word
you, sir.
of
Thank you so much.
advice to Abba Saeed to please don't take it as a failure, but just take it as a challenge. Thank you very much. I'll beg your leave.
Great words of wisdom. Thank you very much for your kind comments, sir. Wonderful advice there. So there has to be one team that gets a higher score and one team with a lower score. Abbasi Shaheed Hospital put themselves out there. I give them their due. They came, they competed. There's always a risk that you don't quite perform in the way that you want to perform, but use it as a springboard, use it as a challenge, as Professor Ishaq Saab said, and come back stronger next time. You never know. Maybe ASH challengers take up the challenge and win the whole thing next year. It's quite possible, and I'm sure they're going to work hard on themselves for the next competition. As for Sheikh Zayed, well, they're in with a great chance of getting through to the Super 6. It totally depends on the other teams, but they're worthy winners of this contest today. I have to give them credit. They stayed calm under pressure. They got a few questions wrong, but they fought back hard at the end. So congratulations to our winners, Sheikh Zayed Lahore Roarers, and commiserations to ASH challengers, but I'm sure that they will come back much, much stronger next time. So without anything else, we've progressed. We've gone through match number 16. Next time is match number 17 in Group F. And let's see who can make the Super 6, and let's see who can make the final. The final hopefully will be in Lahore at the Pakistan Hypertension League meeting. And I'm looking forward to moderating that with my wonderful colleague, Dr. Hamza Ghori. So there are matches left, and one champion will be crowned nationally, and something to look forward to in the future. Thank you very much from our team at Wilson's Pharmaceuticals, and from me, Dr. Qurban Khan. Allah Hafiz.